Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. It's the simple things that we don't do very well in healthcare, and I want to focus in this video on 3 very important things that you should remember when either you are hospitalized one day or a family member is hospitalized one day. This is something that is inevitable, unfortunately. Either you or a loved one will be hospitalized one day, and when that happens, many people really see where we fall short in the system, and it has been my consistent experience having worked in different countries. In the United States, I've worked up and down the East Coast, and it's the simple thing, the low-hanging fruit, that we don't do well in healthcare because we're so focused on the quote-unquote high-end treatments and therapeutics, but we forget all the little things that we can do to help our patients recover. So here you go, 3 things that I really want you to remember for the day either you are hospitalized or a loved one is hospitalized. Number 1, use of an incentive spirometer. This is a very simple device, and it is designed to keep the lungs expanded. And it should be part of protocol for many different hospitalizations. Surgeons tend to use it a lot after surgeries, but they can be used medically for many different conditions. There are some conditions where it's not advisable to use it, like if somebody's got acute lung inflammation, but for many other conditions, it is very good to use. And as I said, it's a very simple device, and you use it by basically you breathe out first, and then you put the device in your mouth, and you take a deep breath in slowly, as much as you can, expands your lungs. Then you try to hold your breath for a second or 2, and then you turn away and you breathe out. And you do that a few times, and I recommend that most of my patients do it as often as they can, often several times every hour. Obviously, if you or a loved one is in the hospital, ask your team and make sure there's no reason why you shouldn't be doing it. And basically, the theory behind how it works is it keeps your lungs expanded. It reduces the chances of what we call atelectasis, various parts of your lungs collapsing and not being aerated. It helps to clear secretions and overall lowers the chances of lung complications, including pneumonia, which is one of the most common complications of being in the hospital. So the basic premise is you keep your lungs as strong as possible while you are recovering from illness. Number 2, out of bed to chair and move around as much as possible. I have talked about this previously, and it's a subject close to my heart. I'm a certified personal trainer, so I am all about people getting up and getting moving as quickly as they can to aid their recovery. And it's quite heartbreaking, to be honest, because I've seen this happen thousands of times. Relatives will come in very concerned about their loved one who is in the hospital, and they'll almost be begging the staff to get them up and start moving because hospitals simply don't do it. It is not a priority. And what they see is their loved one is getting weaker and weaker, what we call deconditioning. Their muscles are getting weaker, and then they have a prolonged recovery, and they're much more likely to suffer with complications if they have this problem. This is what I call sinking in bed syndrome, and it happens to thousands of patients every day. So I would encourage you, if you see this happening in a loved one or if it's happening to you, really get on the backs of the staff to get you up and get you moving. And why are we not good at this? Well, all sorts of reasons. Again, primarily because we miss the low-hanging fruit in healthcare. We miss the very obvious. Obviously, if someone is recovering, you don't want them to just lie in bed. And hospitals are not fully invested on enough staff to help. The nurses are really stretched. They don't have time to do it. We don't have enough mobility aids. We don't have enough physical therapists. So this is why thousands of patients languish every single day with sinking in bed syndrome. Must get out of bed to chair, move around as much as possible. As a doctor, I will often write that order in capital letters. Patient must get out of bed to chair at least 3 times daily and move around as much as possible, particularly important for the older population. Number 3, avoid sugar. I can't emphasize this enough. And hospitals are bad enough with what they feed patients. But how often do I see loved ones bring in sugary treats for their hospitalized relative? I know this is culture in Western countries, including the United States, United Kingdom, and this is a message directly to anybody out there who has a loved one hospitalized. I know you mean well. I know you think it's a very nice thing to bring your loved one a sugary treat, but take it from me, the absolute worst thing that you can do for somebody who is sick and inflamed is pour sugar into their bodies. Sugar is very pro-inflammatory, and anybody who is sick should absolutely not be consuming huge amounts of sugar. It is the worst thing for them. If I was ever hospitalized, firstly, I would never eat the junk food which is served in most hospitals around the country. I would insist on a relative bringing in some healthy sources of protein, and tasty as well. I would prioritize protein. I certainly wouldn't drink any of the junk fake drinks. I would be trying to take in as much protein as possible, and I would be minimizing refined carbohydrates and sugars. So there you go then. 3 things that I would like you to remember if you or a loved one is ever hospitalized. Number 1, incentive spirometry. Number 2, get out of bed to chair and move around as soon as possible. And number 3, absolutely minimize sugar intake. And I know this is difficult because especially with the last 2, we have a culture where basically the opposite is being encouraged. So it is on you to help yourself or to help a loved one. I would really encourage those low-hanging fruits, no pun intended, to aid in your recovery. Thanks everyone for listening. Feel free to comment down below. Let me know your thoughts on what I've just said. I enjoy all of your comments. Check out my Health Academy, that link is down below. Hit the like button if you like this video and the bell button for more similar videos in the future. That really helps with the algorithm and getting these videos shared as widely as possible. Take care everyone, we will speak again in the next video.